Morning all. This is Dr. Pavitra from Department of Community Medicine, NFI Medical College. I welcome you for today's event, opening of Community Medicine Department Alumni Chapter of NFI University Alumni Association, release of department newsletter, and guest lecture on TB care during COVID-19 times in Karnataka. Now I request Dr. Poonam Naik, Professor and Head, Department of Community Medicine, to deliver the welcome address.
Respected dignitaries, dear colleagues, friends, and alumni, a very good morning to all. Department of Community Medicine, in association with Unipoya University Alumni Association, organizes the launch of Community Medicine Alumni Chapter. We plan to organize various activities with our alumni network, such as quarterly newsletters based on the special achievements made by our alumni, both faculty and PG, in their professional as well as personal life, conduct of guest lectures by our alumni meet, and many more. I'm confident we'll be able to establish a successful network with our alumni, stay connected as a family, and most important, we look forward for mutual learning. Today's event is our first step towards achievement of this goal. On the occasion of launch of Community Medicine Alumni Chapter, we have with us Dr. Gangadhar Somayaji, Registrar, Unipoya University. I welcome you, sir. It's a pleasure to have Dr. Lalita K, Professor and Head, Community Medicine, MS Ramaya Medical College, Bangalore, with us today for this program. Welcome you, madam. I welcome Principal Dean, Unipoya Medical College, Dr. MS Musabba, the Associate Deans, Unipoya Medical College, Dr. Abhay Nirgure, and Dr. Ashwini Dutt for this event. It gives me immense pleasure and happiness to welcome our own PG alumnus, Dr. Nishchit KR, currently working as WHO NTP consultant for the state of Karnataka. Welcome, Nishchit. I also welcome the UA President, Dr. Irfan, Secretary Dr. Migdad, and Dr. Imran, the former UA President. Welcome all. I also welcome the heads and faculty of various departments of the constituent colleges of Unipoya deemed to be university. We are overwhelmed to have nearly 200 participants registered for this event belonging to the public and private sector from various academic institutions as well as the public health organizations with wide geographical representation. We extend a warm welcome to all our participants. It's a happy and precious moment to have with us today both our faculty and PG alumnus from the first batch of PGs of Community Medicine Department of Unipoya Medical College. A hearty welcome to all of you. I welcome Dr. Madhvi Bhargava and Dr. Pavitra, Faculty of Community Medicine, organizing secretaries of this event, and they are also the alumni coordinators of the department. I welcome all my colleagues from the department and students for this event who will be our future alumni. Welcome all to this event, and we look forward for a grand success. Thank you.
Thank you, ma'am. The next event is launch of Community Medicine Department Alumni Chapter of Unipoya University Alumni Association. Today, we have with us Dr. K. Gangadhar Somayaji, Honorable Registrar of Unipoya deemed to be University. Dr. Somayaji sir has done his graduation from Kasturba Medical College, Mangaluru, and his post-graduation from Bangalore Medical College. Sir is trained in micro-ear surgery, endoscopic sinus surgery, and general otolaryngology. He has completed basic medical education workshop and has been faculty for some of the medical education workshops. Sir has completed 21 research projects as PG guide and is guiding 4 more research projects. He is recognized guide for PhD under Unipoya University, guiding 1 student.
Hello.
Yes, sir.
Hello, Dr.
Yes.
Poonam, I am audible?
Yes, sir. Yes,
Yes,
sir.
sir.
Hello,
Yes, yes, sir. You are audible, sir.
you are not audible here. All these days, till now you are audible. Now both of you are not audible. Dr. Poonam, Dr. Pavitra.
Sir, we can hear you,
Others
sir.
can hear Dr. Pavitra and Dr. Poonam.
Yes, sir. Yes, sir. You are audible
Some
for us,
mistake
sir.
maybe from my side. Let me just check for a minute.
Yes, sir. Yes, sir. Sure, sir.
Hello, can one of you speak now?
Yes, sir. Am I
Yeah,
audible, sir?
yeah. Now you are audible. Yeah.
Yes. Thank you, sir. Dr. Somayaji sir has published 53 research papers, case reports, review articles in national and international journals of repute. Sir is external member for ENT Curriculum Monitoring Committee and BOS at NITTE deemed to be university. He is also faculty for hands-on courses on temporal bone dissection and cadaver sinus surgery courses. Sir has successfully organized many CME and live surgical workshops on micro-ear surgery, general otolaryngology, endoscopic sinus surgery, radiology in ENT, CME, and workshop on vertigo at Yanapoya University. His area of expertise and interest include micro-ear surgery, endoscopic sinus surgery, and cochlear implantation in addition to medical education and research. I now request Dr. Somayaji sir to speak a few words on this occasion. Over to you, sir.
Good morning. I'm audible.
Yes, sir.
Yeah. Thank you. Respected dignitaries, Professor Dr. Lalita, Professor and HOD from MS Ramaya Institute of Medical College, Dr. Nishchit, our own alumni and presently working as NTP consultant, WHO, Dr. Abhay Nirgude, the in-charge dean, Dr. Poonam Nayak, the head of the Department of Community Medicine, faculty members, members of the alumni, ladies and gentlemen, a very warm wishes and good morning to all of you. In fact, it's my privilege to be here today, and I feel honored to launch the Alumni Association subdivision or the branch from the community medicine. It's a part of our Yanapoya University Alumni Association. The Alumni Association of the university has been doing a good job, and of late they have started releasing sub chapters. Recently we had from the medical college radiology subdivision organizing a guest lecture like this, and now today we are having community medicine. Activities like this, are basically important. It is not just another guest lecture, because the topic is of current relevance. Whatever Dr. Nishchit is going to speak today, I'm sure it's a matter of current relevance. And number two, this particular talk is being given by our own alumni. So in fact, it's a proud moment for the department as well as for the college and the university when our own student becomes, a recognized figure elsewhere and comes back to the college and gives a talk like this. It's a pride moment both for the alumni as well as for us. I congratulate Dr. Poonam for having taken this initiative of organizing this particular guest lecture today. And also I thank on behalf of the university Dr. Nishchit for having accepted this and having taken time out of his busy schedule to be here today to enlighten us with this particular topic of current relevance today. Coming to the topic as such, I'm not an expert in public health nor in community medicine, but of course, tuberculosis is a global problem, and as ENT surgeon, I have seen a lot of cases because tuberculosis is one entity which can affect right from the scalp till the toenail, any organ of the body, and ENT is not an exception. I have seen in fact, a variety of cases affecting, getting affected by tuberculosis in ENT territory, including tuberculous laryngitis, tuberculous otitis media. In fact, we have seen peculiar cases, including lupus. So tuberculosis is one such entity which can be of relevant topic for any specialty, especially in the present scenario, that is the COVID-19 scenario. Initially, in fact, I was probably under the wrong impression that the incidence of tuberculosis might come down because of the use of mask and social distancing and all other things. But after reading the literature, I have realized that in spite of whatever said and done, that is the mask, social distance and all those things, we have probably going towards a dangerous kind of situation where the diagnosis itself probably has been hampered by the lockdown and the post-lockdown scenario of nearly now almost 1 year now. Because of this, probably we have been pushed 5 years backwards in the control of tuberculosis, as well as in reducing the mortality related to tuberculosis in India. We need to remember that tuberculosis is in India, in fact, accounts for nearly 25% of the global tuberculosis burden, and probably 1/3 of the global multi-drug resistant tuberculosis cases are in India. And we do come across a lot of deaths, which is quite significant, at least in an Indian scenario. So keeping all these things in mind, I'm sure Dr. Nishchit is going to enlighten us about, in this present scenario, how to tackle tuberculosis. I once again congratulate the department and the speaker for being part of, and I thank the organizers for having made me a part of this particular program. Thank you once again.
Thank you, sir, for gracing the occasion despite your busy schedule and for launching the department alumni chapter. We are glad to inform you that Department of Community Medicine, Yanapoya Medical College has developed an alumni newsletter, Community Alumni. This newsletter is developed and designed with an intention to connect more with our alumni by sharing the achievements and the news. We wish to keep ourselves updated and add more achievements in the upcoming volumes. We have Dr. Lalita K., Professor and Head, Department of Community Medicine, MS Ramaiah Medical College, Bengaluru. Dr. Lalita K. has done her graduation and post-graduation from Kempegowda Institute of Medical Sciences. Her research areas of interest are healthcare waste management, geriatrics, tuberculosis, and immunization. Ma'am has worked as one of the co-investigators for ICMR-funded project titled Establishment of Population-Based Rural Stroke Registry in India, a pilot study, and also as a principal investigator of RGHS-funded project titled Epidemiology of Disability Among Elderly in an Urban and Rural Area for Development of Feasible Model of Care, an exploratory study, and also an OR project funded by State TB Cell on validation of reporting of adverse drug reactions under PPP program of RNTCP in BBMP area, a mixed method approach. She has 25 publications in various peer-reviewed national and international journals. She is a recipient of Young Scientist and Catch Millennium Award from Karnataka Association of Community Health in 2004. She has also been awarded the Member of Academy by the National Academy of Medical Sciences, New Delhi. In recent COVID pandemic, she was deputed to the State Surveillance Unit of COVID-19 as a member of SOP Committee for Government of Karnataka, and she is one of the co-investigators for the serial cross-sectional sentinel survey for estimating COVID-19 burden in Karnataka. Recently, MS Ramaiah Medical College hosted the prestigious 32nd state-level annual conference of Karnataka Association Community Health in December 2020, for which ma'am has served as organizing chairperson. I now request Dr. Lalita K. to release the department newsletter and speak a few words on this occasion. Over to you, ma'am.
Ma'am, am I audible?
Yes, you are audible, madam.
Yeah. Please go.
Madam, you may reduce the speaker volume of one of the systems so that there is no echo. Now you can unmute yourself and
Ma'am, open
Madam, if there are two systems on, you can shut down one.
Sir, I will share and stop this.
So our first newsletter comprises of messages from our faculty alumni, senior faculty Dr. R.P. Pai and Dr. Varun, who were with us for a long time, and we have good memories of working together. We have also focused on the achievements of our alumni. So we have also highlighted the professional and personal achievements of our alumni, and we are happy to do so. So these are our faculty and PG alumnus from 2015 and from the first batch of PGs of Yenepoya Medical College Community Medicine Department. Thank you, Dr. Lalita, for release of the first newsletter of Community Medicine alumni. And for gracing this occasion, I now request Dr. Pavitra to propose the vote of thanks. I now request Dr. Lalita to say a few words on this occasion.
Audible here?
Yes, madam, you are audible.
Okay. Dear dignitaries, Dr. Poonam ma'am, the registrar, Dr. Abhay sir, and all the alumni today who have joined here. I thank this opportunity for providing me this opportunity. Thank you, ma'am. It is indeed my honor to release this first issue of newsletter from Alumni Network of Department of Community Medicine, Yenepoya Medical College. I know it's a proud moment for the department and alumni to launch this event. I had an opportunity to visit the department on 2 occasions, and I've seen the department grow in strength. It is really commendable that Yenepoya, which started in 1999, has rose very quickly, and the department also grown in strength with PG course starting in 2012. I've seen closely the faculty and the PGs who work as team with great enthusiasm share and collaborate. While I was browsing the website, I was happy to note that on eve of National Science Day 2020, the Department of Community was awarded the best department for its research output. Congratulations, ma'am. I especially congratulate Dr. Pavitra and Dr. Madhavi Bhargava for taking this lead and initiative to bring out the first issue of the alumni newsletter. The first is always special. As you are excited to share your first issue, so am I. The theme, especially the end to aspire community alumni, is something which is very catchy. And as I was releasing, I was remembered of my alma mater. It is always good to connect with our alma mater, where we have learned and benefited from these institutions. And I believe that alumni network is the face value of any department or any institutional success. And creating an engaged, supportive network brings benefits not only to the alumni, but also to the institution. As an institution, the alumni are our most loyal supporter and brand ambassador of the institution, which spreads our success across the globe. In today's world, which is connected digitally, it is all the more easier to get connected, network more, and reach to more. Especially this COVID unprecedented pandemic has underlined the importance of being connected digitally. And I think the organizers have taken this opportunity to reach more beyond the national level as well. The purpose of an association is not only to foster the spirit of loyalty and promote the welfare of an organization, but it also has benefits to the individuals and to the department. It not only helps to connect the alumni and the community and the alma mater, it hugely helps the institution align itself to the vision, to increase itself to the quality of care, because it will be on the global platform and it will help them to be better, and also help them in the NAC accreditation as well. And for the alumni, it not only connects you between each of you, it also renders you more responsible, because you are taking the flagship of the institution. And it enhances the employment opportunities, connect yourselves, share your experiences, share your research, and an opportunity to collaborate together across not only national, even at the global level. I wish all the best for the association, and keep up the momentum going and increase your reach in breadth and length. I know this is just a beginning, and this proud of your alumni association should grow in strength and become a big banyan tree to engulf more and more alumni to come into this. At this moment, it made me also to remember my alma mater, and I take this opportunity to remember my alma mater and thank all my teachers for what I am today, both from undergraduate and postgraduate. I thank my guide, philosopher, mentor, Dr. M.K. Sudarshan, who is a well-known name in the community medicine, and all my teachers, Dr. Rajanna, Dr. Parishramlu, Dr. Ganga Boraya, Dr. Mahendra, and Dr. Ashwath Narayana from KIMS. Dr. Pavitra and Dr. Madhavi, I congratulate you and also wish you all the best to take it forward and have much more wings to it, not just with a newsletter. We have started with a webinar. I know Dr. Nishchit also, very dedicated alumni of your institution and growing well in the WHO. To start with him is very good. Congratulations, Nishchit. And I'm sure the younger postgraduates or the future ones who are looking to join community medicine will be inspired by your talk. So wish you all the best and much more. You come together for the newsletters or alumni meet, share and take the flagship of Yenapoya Medical College to global heights. Wish you all the best, and I thank you for giving this opportunity. Thank you, Poonam ma'am.
Thank you, Dr. Nalita, for your kind words of appreciation and for being with us on this occasion today.
I'm sorry, audio problems, sorry, initially.
No, that's fine, madam, no issues. So thank you, madam, for being with us on this occasion. As you rightly said, this alumnus meet brings out our happy memories of our own alma mater, and it gives me happiness to mention that today Dr. A.G. Kulkarni is also there here, who was my teacher during my undergraduation. So welcome, Kulkarni sir, to this event. Thank you, madam. I now request Dr. Pavitra to propose.
Dr. Poonam, Dr. M.K. Sudarshan sir also has joined. So we will welcome sir.
Welcome, sir. I now request Dr. Pavitra to propose the vote of thanks.
Thank you, ma'am. It is my pleasure to propose the vote of thanks on this occasion. I express my sincere and heartfelt gratitude to the Honorable Chancellor of Yenapoya Deemed to be University, Yenapoya Abdullah Kuni, for the constant encouragement and support. I express my heartfelt gratitude to our Honorable Pro-Chancellor, Mr. Farad Yenapoya, for the constant encouragement and support. I express my heartfelt gratitude to our Honorable Vice Chancellor, Dr. M. Vijay Kumar, and Pro Vice Chancellor, Dr. Shripati Rao, for their constant encouragement and support in all our endeavors. I express my gratitude to Honorable Registrar, Dr. K.S. Gangadhar Somayaji, for extending his support and motivation. I also express my sincere gratitude to Dr. Lalita K, Professor and Head, Department of Community Medicine, MS Ramaya Medical College, for taking time and gracing this occasion. I would also like to thank Dr. M.S. Musabba, Principal, Yenapoya Medical College, for his support and guidance in all department activities. I also extend our sincere thanks to Dr. Abhay S. Nirgude and Dr. Ashwini Dutt, Associate Deans of Yenapoya Medical College, for their support and encouragement. I thank Dr. Nishchit KR, NTEP Consultant, WHO, for gracing the occasion and for his upcoming guest lecture. I would like to express my gratitude to Dr. Poonam Marnaik, Professor and HOD, Department of Community Medicine and Organizing Chairperson for today's event, for her invaluable guidance and constant support. I also extend my sincere gratitude to Dr. Madhavi Bhargava, Assistant Professor, Organizing Secretary for today's event, for her guidance and support. Community Alumni Newsletter was primarily designed and developed by Madhavi Ma'am. I would like to express my sincere gratitude to Dr. Imran Pasha, Reader, Department of Public Health Dentistry, for all his support in organizing this program. I thank Dr. Irfan, Associate Professor and In Charge Head, Department of Respiratory Medicine and President UVA, for his constant support. I also thank Dr. S. Mohammad Mikdad, Lecturer, Department of Oral Pathology and Secretary for UVA, for his support. I thank Mr. Abel P. Chiramal, Final Year Part 1 BDS student, for creating the video of launch of Department Alumni Chapter. I also thank Department of IT, Yenapoya Deemed to be University, for their support in successful conduction of this online program. I thank all faculty, PGs and staff from Department of Community Medicine for their invaluable support and efforts in organizing this program. My sincere gratitude towards photographer for covering the program. Finally, I thank each and everyone gathered here for making this event a successful one. Thank you all. We now proceed with guest lecture on this occasion by our PG alumni, Dr. Nishchit KR, NTEP Consultant for WHO. I request Dr. Madhavi Ma'am to introduce Dr. Nishchit KR to our audience.
Good morning, everyone. I hope I'm audible. It's my great pleasure to introduce Dr. Nishchit, who is an alumnus of Department of Community Medicine, Yenapoya Deemed to be University. He completed his post-graduation in 2018, and he's one of those students who push teachers to do better and better and make all our efforts worthwhile. I must say that we have been fortunate to have many such alumni from this department. He completed his undergraduation from Basaswareshwara Medical College, Chitradurga in 2014. During his post-graduation, he was completely involved in all department activities, and he worked on very socially relevant research projects like community management of waste and waste segregation at source, and disability preparedness at primary health centers, etc. He's a public health practitioner and an epidemiologist with a very keen interest in epidemiology and control of communicable diseases, especially tuberculosis. He is presently working as a medical consultant for the WHO for the last 2 years. He worked in very diverse and extremely challenging conditions in the tribal and underserved areas of Chhattisgarh for more than a year. And he has many stories about his field visits in those far and difficult to reach areas. He's now posted in Karnataka, where he's a technical consultant for RNTCP, now renamed as National TB Elimination Program, and he's based in Bangalore. He also coordinated the WHO Joint Monitoring Mission in Chhattisgarh in 2019 and the WHO response to Cyclone Fani in Odisha. He will be sharing his first-hand experience on tuberculosis care during the COVID-19 times. We all know that is one of the most discussed and debated topic in the recent times. Over to you, Nishchit. Look forward to hearing.
Thank you, ma'am. So, welcome back, everyone. I hope everyone is doing good, and I'm quite excited to be back in Anapoya, and also in the meanwhile, little apprehensive to speak in front of my teachers about today's topic, that is TB care during COVID-19 times in Karnataka. So, coming to the overview of this presentation, first and foremost, briefly I will be telling about the unfolding of COVID-19 pandemic in Karnataka, and next I'll proceed to the overview of TB care in terms of notification, drug susceptibility testing, drug resistant TB, HIV TB, and TB diabetes, and Nikshep Poshan Yojana, so on and so forth. And we'll briefly touch about what impact COVID-19 had on TB notification. So next I'll proceed about what are the initiatives the state took to improve the TB notification in Karnataka, and what are the opportunities the COVID-19 pandemic has thrown towards TB program to strengthen itself. So coming to the story of COVID-19 pandemic in Karnataka. So once again, yeah, thank you. So the vertical axis towards your right side says about the total COVID test happened in Karnataka, and the right side vertical axis tells about the positivity rate, and the horizontal axis tells about the month of the COVID-19 pandemic. So if you see, the first COVID-19 positive case was notified in Karnataka on March 3rd, which was imported case, and the first death of COVID-19 that too happened in Karnataka on March 12 in Gulbarga. So the first initial few months, that is March, April, and end of the May, the total positivity rate of the COVID-19 remained less than 1. And the total number of tests performed per week, the average number of tests performed per week was approximately around 20,000 to 30,000 per week. The total number of cases during this period remained less than 2 digits, which is largely attributed to the unlock in the country, and also the individuals movement, people movement restrictions, and also closing of the facilities and all. So coming to the positivity rate of the COVID-19 started increasing from May last week, and sharply increased from there afterwards, and reached its peak around 18 of positivity rate in the month of July. In July last week, the sample positivity rate was around 18. And the total number of tests performed from 20,000 tests per week to has rise to the 1.8 lakh tests per week, average number of tests. And the total number of cases was in 2 digit in the May last week, and it has been rose to the 4 digit and doubled. And initial part of the May, it was around 20-40 cases. And in the July last week, it has come up to 4,000 cases per day. So these cases is attributed to the unlock happened during that time, and the interstate movement and mixing of the population happened during this time. And all were the clusters were related to the interstate movement and the contacts of those interstate travelers. So if you see from July last week to the October last week, the positivity rate somewhere remained around 12 to 14. And the number of tests performed has raised from 1.8 lakhs to around 4 lakhs tests per week, average number of tests. So during this time, the number of cases has had a huge surge. The daily reported cases were approximately around 10,000 cases per day. And this is due to the large outbreaks happened during this time. And during this period, there was a huge demand for the COVID-19 services in the state, and most of the system was placed to provide the COVID-19 care. And if you see from October to December till today, the positivity rate was around sharply started declining from the October last week to the sharply decline. It was around 12 at the end of the October last week, and it has reached less than 1 in the last week of December. And the total number of tests, if you see, it has been raised sharply, and now the state is performing tests, 7 lakh tests per week. That means 1 lakh tests per day. It's been happening in the state. Still, the number of cases has reached less than 4 digits. That is, yesterday it was around 600 cases per day. So, in short, if you see, in the initial months of the pandemic, the COVID cases were largely limited to the imported cases and the cluster originating from that. From May last week to July last week, the cases were attributed to the interstate movement and the cluster and originating from that. And in the July last week to October last week, the cases were was due to the mixing of the population and larger outbreaks which were originating from the mixing of the population. So if you see, in summary, there was a huge demand for COVID-19 services in the July last week to the October last week. These 3 months completely, there was a complete system was placed to work on the COVID-19 services. So here we go for a TB story. So if you see the presumptive TB examination rate and notification rate from 2015 to 2020, the blue line is presumptive TB examination rate and the orange one is the notification rate. In 2015, there were 864 per lakh population were tested for TB, and the notification rate per lakh was 102. From 2015 to 2019, there was a steady increase in the number of tests happening in the Karnataka for TB, and the notification has also increased from 102 to 136, and the examination rate increased from 864 to 1547 per lakh population. So if you see from last 4 years, last 5 years, there was a steady increase in the notification.
Nishchit, I'm sorry to interrupt you. Can you click on the hide button of that slide sharing so that we can see the legends?
Thank you, ma'am.
Over.
Is it fine, ma'am?
Thank you.
Yes, ma'am. So in 2019, there was a 33% increase in the TB notification as compared to 2015, and the examination rate was increased by 55% as compared to 2015. In 2020, due to the COVID-19 pandemic, the examination rate has gone by 15472 to 702 per lakh population, and the notification rate has been fallen from 136 to 91 per lakh population. In short, prior to the COVID-19 pandemic, Karnataka state was making steady progress in tackling tuberculosis with 33% increase in notification and 55% increase in the TB testing compared to 2015. And due to the COVID-19 impact, there is a 56% fall in TB testing and 31% fall in TB notification as compared to last year, that is 2019. So are we losing the gain made in last few years? The answer seems to be yes now in terms of COVID, in terms of TB notification. And if you go for a head-on comparison of TB notification of 2019 versus 2020, the 2019 is prior to the pandemic, the 2020 is during the COVID-19 times. The blue line is 2019 TB notification, the green one is 2020 notification absolute numbers, and the red line is the percentage decline. If you see in January 2019, the total notified cases were around 9,000. In Jan 2020, the notified cases were around 8,302. The fall was 8.5, which was very negligible. And in February, the notified cases in 2019 was 7,615. In 2020, it was 7,542. The fall was 1%. If you compare Jan and February of 2019 and 2020, the fall in TB notification is very negligible. And if you see the March data, in March 2019, there were 8,122 TB patients notified to the program. In 2020 March, there are only 6717 TB patients notified to the program, and that fall in TB notification was 17% in March. If you see in April, the fall in notification is 50.4, and in May, the fall in notification, TB notification was 37.1. This 3 months fall in notification is largely attributed to the lockdown and which come along with the restriction of the people movement and closing down of the health facilities, and the facilities repurposed for providing COVID care. And we did a small intervention in the May, which I'm going to tell in the last slides of this presentation. In June, if you see, the notification has fallen to 90.7. That means from 50 in the April, we were able to recover around 30% of the cases which were missing. And still the loss was 19% in the June. If you see the July, the falling notification was 54.5. And in August, the fall in TB notification as compared to 2019 prior to the pandemic is 45%. And in September, it is 42%. If you see these 3 months data, this has a story to tell. The story here is, during the July, there was a rapid surge in the number of COVID cases, and all of the health system was able to provide the services which was required for COVID only. Most of the TB services were ample during these 3 months. And in October, November also, there is a fall in TB notification by 37 and 34. In March also, which was coming around 30%. In short, initial few months loss in TB notification were due to the lockdowns, movement restriction, and closing of the health facilities. And whenever there is a huge demand, which we saw in July, August, and September and October, around that time, there were sharp decline in the TB notification because all of the system was repurposed for providing services to the demand which was arising from the COVID-19. And till today, there are substantial reduction in TB notification, which are sustained over successive months, have been observed in 2020. So the main casualty of COVID-19 pandemic is the TB notification. If you come to the TB case holding, one of the main indicator for TB case holding is the proportion of TB patient tested for rifampicin resistance. If you see, compare 2019 with 2020, so all TB patients should be tested for rifampicin resistance to detect drug-resistant TB and put them at appropriate treatment in a right time. So for that, in 2019, 66% of the TB patients were tested for the rifampicin resistance. In 2020, 76% of the TB patients were tested for rifampicin resistance. That means there is a sharp increase in the 10% prior to the COVID pandemic, the testing status. So what are the reasons? I'll come to that in the last part of the case holding. And if you see another indicator of the case holding, DRTB patient, 2019 versus 2020. In 2019, there were 2,082 DRTB patients were detected in Karnataka. Among them, 85% were put on treatment. And this 2,000 constitutes to the 2% of the total notified. And in 2020, till September data, again, the 1,096 DRTB patients were detected in Karnataka, which constitute to the 2% of the total notified. Among them, 87% were put on treatment. That means in DRTB, the state was able to perform as good as 2019. So coming to the status of HIV among TB patients for 2019 versus 2020. In 2019, all TB, we know that TB patients are vulnerable to getting HIV, and there are higher risk for HIV patient to get TB and TB patient to get HIV. So all TB patient has to be tested for HIV and put on treatment. So in 2019, that is prior to the pandemic, 90% of the TB patients were offered HIV testing. In 2020, 94% of the TB patients were offered HIV testing. There is in HIV status also, the state was able to perform as good as 2019. So coming to the proportion of diabetes testing in 2019 to 2020, The program policy is to test all TB patients for diabetes. In 2019, 83% of the TB patients were tested for diabetes. In 2020, during the COVID pandemic, 88% of the TB patients were tested for diabetic. So here also, in the case holding part, the program has been able to do as good as 2019 or slightly better than 2019. So if we come to the Nikshay Poshan Yojana, so Nikshay Poshan Yojana, one of the flag scheme of the Prime Minister of India, where all TB patients will be given rupees 500 every month till they complete their treatment. If you compare what happened in 2019, that is prior to pandemic, and what happened in 2020. In 2019, this rupees 500 is directly directly transferred to the patient account number through Nikshay and PFMS interface. If you see in 2019, 80% of the TB patient accounts were seeded in Nikshay. 2020, 86% of the TB patient accounts were seeded in Nikshay. There was an increase by 6% in 2020. And how many of them were paid? In 2019, 77% of the TB patients were able to get the Nikshay Poshan Yojana benefit. In 2020, 78% were able to get the benefit. In Nikshay Poshan Yojana also, the state was able to perform as good as 2019, that is prior to the COVID-19 pandemic. So if you see, there is a definitive fall in the TB notification, and in the case holding part, we have seen the 5 main indicators of case holding where the state was doing as good as 2019 or do slightly better also. If you see other indicators also, if you see the TB quality of care, one of the main indicators is number of microbiologically confirmed. In 2019 also, the microbiologically confirmed was around 60%. In 2020, the microbiologically confirmed was 61%. Number of TB patients put on treatment, it was 95% in 2019. It is 96% in 2020. In the case holding part, the state TB program has been able to hold the momentum what was gained in 2019. This was possible due to the three main reasons. One reason was the advanced directives were issued to the districts and the talukas to ensure the continuity of TB services. And there was immediately before the pandemic, before the lockdown, there was a circular which went from the state to provide 2 months of TB medicine to all the TB patients, and which was meticulously followed up and reviewed. And the review with the districts were happening regularly. There were 3-4 quarter review which happened during 2020 virtually, and the underperforming districts were called specially for the meeting, and the state was able to handhold them and do better in case holding part. And as I said earlier, there was a provision of extended duration of drugs for 2 months. Initially, now it's up to 1 to 2 months was provided to the TB patient, and doorstep delivery was also given to the patient who were not able to come to the facilities. And there were advisory issued to the district TB program for the extra precaution which TB patient has to ensure when they visit the health facilities. And one thing which I want to say, there were dedicated TB program staff in the Karnataka. So there are around 1,500 TB program staff which are dedicated to provide TB services to all the TB patients. So they were quite dedicated, and here the lab technicians, DTOs, one part of the HR was taken for the COVID, but largely the STS and the TB health visitors were left for the TB program, where they were utilized better, and the case holding was done better as compared to 2019, little better. So as I said you that 2 stories, one is the case notification and the case holding. Now we know that COVID-19 pandemic has disrupted the TB notification as compared to last year by 31%. So which was quite sustainable over successive months. So coming to the reasons for loss in TB notification, there is a shrinkage in the facilities providing TB care. So the shrinkage happened because the health facilities were repurposed to provide COVID-19 services. The other reasons was few old practitioners or the small clinics were able to close down their services because fearing for COVID-19 and fearing for their life. If you see the existing data in 2019, 1832 public health facilities had notified TB patient to Nikshay. In 2020, 1478 public facilities are only notifying. That means there is a 20% shrinkage in the public health facilities which are notifying TB patient as compared to last year, which is evident. And in the private health facilities, the shrinkage is in Nikshay is only 4%. And the second main reason was fewer footfalls in facilities. So in March, April, they were closing down of the facilities. And if you see the recent data of November 2020 in HMIS, there is a 42% decrease in the OPD attendance in the health facilities, public health facilities, and 49% decrease in the IPD in the public health facilities as compared to the November last year. So still, the patients are not seeking the health care in the health facilities. There may be a deferred or delayed or changed care seeking pattern which may happening at the TB patient level, which we may aware of little. The delayed or deferred may happen, fearing that they may contract COVID-19 infection in the health facilities. There may be change in the care seeking pattern. There may be a different combination and permutation which may happening between the pharmacist or a traditional healer. There may be change in the pattern of care seeking in the TB patient because of the COVID-19, which we should be very carefully looking for in coming months. And the stigma and discrimination. We all know that COVID-19 has precipitated and provoked the human behavior of stigma and discrimination to the unprecedented level. The stigma and discrimination was towards the COVID-19 patient or towards the patient who has symptoms like TB, who have symptoms history of fever and cough. It may impact the TB program, it may impact the care seeking pattern in three different ways. One, it may make the individuals to hide their symptoms to avoid discrimination. The second is it may prevent the individual in seeking the health care which is quite required for them. Third, it may change the pattern of healthcare seeking behavior also. It may discourage people to avoid, discourage the people to adopt the healthy behavior. And next, the reason was human resources and infrastructure diverted for COVID-19 responses. Initial part of the COVID-19, the TB HR lab technician were put to the COVID-19 testing and TB testing, and the DRTB wards were used for isolating and treating the COVID-19 patient. Now the infrastructure is back and most HR all are back to the TB program. So in order to gain what we lost, the state program has done three main interventions to improve the TB notification in Karnataka, which was done from 14 May to July 2020. That is innovative case finding strategies. The first strategy was to offer upfront chest X-ray to all presumptive TB patients, and those who have abnormal chest X-ray, they were offered CBNet. So this strategy was adopted due to two main reasons. One, there was an apprehension among the lab technician to perform sputum smear examination due to the COVID-19 transmission. And second, this algorithm offering chest X-ray followed by CBNet has a high yield when compared to the other algorithms. So from May to July, 16,206 presumptive TB were offered X-rays. Among them, 16% had X-ray abnormalities. They were put on CBNet, and the state was able to diagnose 673. That is the yield of 26%. The normal yield in the normal algorithm is up to the 10%. And the second intervention which the state did was screening of ILA and SARI patient for TB symptoms and screening of COVID-19 negative patient for TB. This screening for ILA, SARI and COVID-19 was done considering one main reason. That was, these are the patient, two reasons. One was, these were the patient who were seeking the care. So we have to screen them for TB. And the other was, the ILA, SARI and COVID-19 symptoms do mimic TB symptoms also. They're quite similar symptoms. Considering that, these two strategies were adopted, and in 14,000 ILA, SARI patients were screened for TB. Among them, 30% patients were presumptive TB. Among them, 442 TB patients were diagnosed. The yield comes up to 9%. And the COVID negative patient, we have anonymous data of COVID-19 patient, and the district and the program staff contacted them telephonically and visited their households to screen for TB. Among them, 3603 COVID negative patients were having presumptive TB symptoms, and when they were tested, 403 TB patients were detected. The yield was 10%. Until July, if you compare the month-on comparison, head-on comparison, May and June, the fall in notification was 17%, 17 to 34%. We were able to recover the loss, recover the loss. But in July, what happened was they were surge in the number of COVID-19 cases. Again, all were diverted to the COVID. We could not continue this as we presumed. So coming to the other intervention which state did the contact tracing from 10th to 17th August. This intervention was done considering the high exposure of TB bacilli to the contacts of TB patient because of the lockdown, because of the restriction of movements. So last 3 months, TB patient households were on treatment, were visited by the TB program staff. And once they visit the TB patient, they have to geolog their TB patient house to the house in the Nikshay. Through that, we were able to review how many households were visited. And among them, 49,000 contacts were screened. Of this, 3760 were identified as presumptive TB, and we were able to detect 100 TB patients approximately. The yield was 2.6%. If you compare the contact tracing drive of the prior to the pandemic also, what yield we are getting during the pandemic is very much compared with the prior to the pandemic. We didn't get extra yield, or we didn't get extra number of TB cases when we compare with prior to the pandemic. So coming to the another intervention which is currently happening from December 1st to December 31st, active case finding is happening in Karnataka for 2 reasons. One is to find the missing TB cases, and other is to gain the momentum what we lost in last year for TB services. So this intervention was very strategically placed when COVID-19 pandemic was tolerable and low in Karnataka, and from last 30 days, we were able to screen 1.42 crore populations, and we were able to get 77,486 presumptive TB patient, that is 0.5%, and the diagnosed TB patient was 2252. See the active case finding intervention in the prior to pandemic, that is 2019, 2018 also, the number of presumptive TB patient in the community, which will come around 0.3 to 0.6%. Here also we are able to get the same number of presumptive TB patient in the community, and the yield was also comparable with the prior to pandemic. The yield before was 2.3 to 2.5, now it is around 2.9. So it's true that COVID-19 pandemic has disrupted the TB notification. There are modeling studies which says that if the disruption is up to 25% is being sustained for next 6 months, that may lead to the more deaths, and we may reach what we have done 5 years ago also. We may reach the stage of 2015 or 2014. Nevertheless, the COVID-19 pandemic has thrown us immense opportunities for TB program to strengthen itself. Now, due to the COVID-19 pandemic, there are dedicated infectious disease isolation wards which have cropped up in district hospital, CHC, subdivision hospital. So the TB patients are better placed. The program is better placed to piggyback on this and provide the inpatient care to the TB patient. If you're quite aware, the deaths in the TB patient happens in the early part of the diagnosis, initial few months only. If you are able to provide inpatient care to the TB patient, we may reduce the number of TB deaths. So these dedicated isolation wards, we can piggyback on this and provide the necessary inpatient care to the TB program. And there are diagnostic TrueNet and CBNAT. These are the similar technologies which are used for diagnosing COVID-19 and TB also. So prior to the pandemic, the state TB program had 65 CBNAT machines. Now, due to the COVID pandemic, around 660 TrueNat machines have come up in the state, and which we are utilizing for providing TB diagnostic services. Now there are around 125 rapid molecular diagnostic centers, and we are able to reach to the level of the block to provide this molecular testing. And as you know, there are sustained behavioral change by the crowd in terms of mask wearing, physical distancing. This behavioral change, what impact it has on TB transmission, we need to be very careful and vigilant, and we need to wait for another few years to see the impact on TB epidemiological model. And there are increased provision of PPE for health personnel and the increased use of home-based care. Here, again, this may reduce the exposure of TB bacilli in the healthcare facilities and the congregational settings and reduce the transmission also. And last, prior to the pandemic and during the pandemic, the healthcare system of Karnataka has been strengthened to handle this pandemic. If you know, in February, there were only 2 labs which were performing COVID-19 testing. Now it has rose to 160 labs, BSL-2 labs. In March, there were only 2,000 central oxygenated beds in the public healthcare system. Now it has been rose to 40,000, a 20 times increase in the central oxygenated beds in the state. And 45 new posts were created in the 18 district hospitals to provide the care, COVID care, and these posts were recruited and all are working. And 700 vacant posts in the Bangalore 12 hospitals, public hospitals, have been filled up during this COVID-19 pandemic. And if you know, there were 1,000 medical officer posts, regular posts vacant in the Karnataka government, and 850 specialist posts vacant in the Karnataka government. And to fill up these vacancies, regular vacancies, through special recruitment committee, the state is driving a recruitment drive, which is happening currently, and through that, the system will be strengthened. I wish and hope the COVID-19 pandemic has thrown up this opportunity. A strong healthcare system, which is going to be strengthened further also, will be able to utilize this healthcare system for TB patient and ensure all TB patients get the required care. And thank you so much for the organizers for giving me this opportunity to speak to all of you and connecting to the Yenapoya. And thank you so much for the attention. Over to you, over to the organizers.
Thank you, sir. I request the audience to fill the feedback form. The link will be posted shortly in the chat box of Google Meet and in the comment section for the YouTube viewers. The e-certificates will be mailed to the email address that you mentioned in this feedback form. So I request all the participants to click on the link that will be provided shortly in the chat box and fill the feedback form. Thank you.
Thank you, Nishchit, for that wonderful presentation. And Karnataka is definitely a better performing state. It's heartening to see how the challenges have been taken as an opportunity. We have excellent public-private partnership in the state, and with very good involvement of medical colleges. We have some very dynamic nodal officers in the medical colleges. We have extensive number of operational research projects which help in improving the services that are being provided. So it will be very interesting to see how this pans out in 2021, and we'll know the figures on, say, deaths in the TB deaths, because that will be one indicator of our success. And it will also be interesting to see the number of childhood TB cases that we diagnose, because that will also be an indicator of transmission that is going on in the community because of the lockdown, greater exposure of the children to positive cases who have been waiting at home trying to get diagnosed. So great efforts. I do not see many questions in the chat box. Okay, there is one question, so I will just read it out, Dr. Nikshit. How will you explain the steady decrease in COVID-19 positivity rate? What happened suddenly that decreased the rate suddenly by the end of October despite festivals like Diwali, Dr. Nishchit?
Thank you, ma'am. And coming to this is it depends on the number of susceptible population who are exposed to the COVID-19. Maybe during this time, there may be a less denominator to get exposed to the COVID-19. Maybe because of that, we may getting the less positivity rate. And in the normal course of events of the pandemic also, there will be a sudden spike which will going to happen in the, if you see across the states and the countries also, the spike in the first wave happened with 2 to 3 months time, and then there was a fall in the TB, fall in the COVID-19 positivity rate. Maybe in the normal course of events, it's possible, and the number of exposed population to the COVID, the denominator is very less, I feel, ma'am.
Yes, and probably the restraint that we showed as population during the festival, probably that helped as well. So, does anybody have any question? Otherwise, we'll close this meeting. Excellent presentation, Nishchit. We really thank you for taking out time. We know you are probably attending meeting at an hour's notice and very busy time for you. But thank you so much for sharing your experience of this much debated topic.
Thank you.
Over to you, Poonam ma'am, for any closing remarks so that we can then close the meeting.
Yeah, thank you, Dr. Nishchit. It was really a proud moment to have you with us. Yeah, so a very informative talk, had a good overview of the current scenario in the state of Karnataka and the role played by the different sectors towards control of both TB and COVID-19. Thank you for that. And before I conclude, I again take this opportunity to thank all our alumni, faculty and PG alumni who are there with us for this event, and all the participants who have registered for the event and attended this, for making it a grand success. Thank you all. Thank you. Look forward to meet all of you again on the next platform. Thank you.
Thank you, ma'am. Thank you all.
Thank you all. Thank you all. Have a wonderful day.